Good evening, everyone. Welcome to CEC course for online classes, that is Administration and Management of Preschool and Daycare Centers. In previous classes, we have learned about importance of registers and records and types of records and registers for daycare center and nature of daycare centers. All this we learned and importance classification of registers and records pertaining to preschool and importance of records and registers, purpose of maintaining records and registers, definition of registers and records, categories of records and registers. All this we learned in previous sessions. And what are the records and what is the purpose of records, how it is useful to maintain the records and registers, how they are useful in developing and promoting a daycare center, and what are the registers and what are the records available, what are the general registers records, in general registers, what are the other administration records, stock registers, official correspondence register, the logbook, etc. We learned. And records for children we learned, that is attendance record and health record, cumulative records and performance progress record. And another thing is teacher related records we learned, and equipment record and financial records. What are the financial records to be maintained in the center, and statistical record. All these records should be maintained in the daycare centers. And now today we are types of records and register for a daycare center. And what are the in this lesson we are going to learn the nature of records. The nature of records and register we are going to learn in this lesson. And in daycare centers are meant for children under 3 years, full-time care where children get love, affection, and security and comfort to develop properly through stimulation of activities. The needs of children attending in a daycare center are different from those of children attending in early childhood education center. Hence, records and registers maintained in daycare center are slightly different from those in early childhood education center. In this, it is essential to maintain records and registers in a daycare center as a guide to the child growth and development. To work successfully with children and stimulate them to achieve optimum growth, it is necessary for the daycare worker to know the child background, home environment, developmental history, health records, and the child's needs and abilities. in, and daycare workers therefore collects the required information from variety of sources and keeps it in a folder to which she adds our own estimate of the progress made by chill in the center. If the center is part of a training institute or research institute, then the records supply the institute with the data for references in child development. Then the nature of records and registers. What is the nature? First, we know the nature of records and registers. First one is admission register. What is the nature of admission register? In a child application for child care, each child must have completed application on file on the first day of attendance and must remain on file for at least 1 year from the data. And child is no longer enrolled in the center. The child parent or guardian must sign the application. The application must be available and easily accessible to the caregiving staff. The completed application must include at a minimum the following information. The child full name and the name of the child is to be called. The full name of child and the name of the child is to be called. Some people, some children having their full name and will be called in short names or sweet names. This should be noted in the admission register and the child application form. The child date of any allergies are unique behavior characteristics that the child has. If any different characteristics having the child, those should be noted down in the application form. It shows in due course to claim according to the things. The child date of birth and names of the individuals to whom the center may release the child as authorized by the person who is signs in the application and date of enrollment. And emergency medical information. In the medical information, the admission number, name of the child, name of the parent occupation, and address for communication, caste, religion, nationality, date of birth, date of joining, date of leaving, and duration of service, needed remarks. All these should be available in the register. The date of enrollment and emergency medical information and admission number, name of the child, all this should be filled in the application form. That is the application form. Name of the child, mother's name, date of birth, and father's name, contact number, emergency contact number, emergency contact number 2, and emergency contact name, emergency contact number, alternate contact number, and allergy or medication, doctor's name, doctor's contact number, if any. All this should be have in the medical emergency medical information. Then name of the child, mother's name, date of birth, father's name, contact number, emergency contact number, and emergency contact name, emergency contact number. What is the type of allergy or what type of medication the children is having, and what are the doctor's name, and what is the doctor reference number. All this information should be recorded in the application form. Then application form should be reviewed for accuracy and as needed to update any important information that might have changed, such as address, phone numbers, and emergency contact numbers. It should be flexible. In due course, may the address may changes and mobile number will changes and emergency contact may changes according to their movements and their personal information. So we need to facilitate the changes space to need to update an important information. So every application should have a accuracy and needed updates. Each child enrolled must have a separate application. Brothers and sisters cannot share an application form. Each child enrolled must have separate application. Brothers and sisters cannot share an application form. The application must be available and easily accessible to the caregiving staff. The complete application must include at a minimum following information. That is, the child's full name and the name of the child is to be called. The child date of birth, that's a you just now we listened. And if the operators choose to develop their own application form, it must include at a minimum every item of information found in child care requirements. In an emergency situation, center staff may need to grab emergency contact information that who is going to inform to contact the name of the contact person in case of any emergency occurred during the institutional hours. So the teacher may contact the person what are given in the application form. And the contact information of children and staff, record applications, attendance list, children health information, etc. to evacuate the center. It might be helpful to store this information in individualized alphabetized folders or compile all the information. The center staff may need to grab emergency contact information for children, staff records, application, attendance lists, children health information, etc. All this information should be available in a particular folder or particular record. It might be helpful to store this information in individual folders that information be useful in future times. The attendance records should be accurately reflect the number of children in care at all times. The caregivers are highly encouraged to maintain daily records of attendance that includes arrival and departure times of children as well as signatures of the parent or authorized individuals accompanying the child during these times. Next, food record. What is the feeding schedule of the student? In what time from morning to evening? What are the food habits of the children? What is the feeding time of the children? What is the food taking time of the children? All these should be maintained in this record. Feeding schedules are required to each children under 15 months of age. This is a crucial age. The schedule must include the child's name, be signed by the parent, call healthcare provider, and be dated when received by the center. It should also include the amounts of food and formula the child should be served and the time intervals, how much time the interval will be given to feed the food or put the some medication. All this should be available in the record, should be noted in the record. Each infant schedule must be modified in consultation with the child's parent and our health care provider to reflect changes in the child's needs as he or she develops. The feeding instruction for each infant must be posted for quick reference by the caregiver. Centers licensed to care for 3 to 12 years of children, 12 age group of children in his residence are not required to post feeding schedule but must have it available for review. The parent or healthcare provider of each child under 15 months of age must give the center an individual written feeding schedule for the child. Everything should be written. The schedule must be posted and followed at the center. The schedule will be posted in the center and followed by the center caregivers. A center licensed to care of 3 to 12 children in a residence are not required to post a feeding schedule, must have it available for review. Each infant's schedule should be updated in consultation with the child, parent, healthcare provider to reflect changes in the child's needs as he or she develops. If a parent makes verbal request for a change to a child feeding schedule, the staff member can note the changes of the child. If a parent comes and given the schedule, this is the time for feeding session for our children, that should be noted by the caregivers and followed by the caregivers. According to the schedule only, we need to follow the schedule. And whenever there are questions about the type or quantity of food listed in the feeding schedule, the caregiver should check the parent with the center's medical consultants. After consulting respective person only, we can feed the child. Otherwise, it leads to a problem. Record income expenditure. Why? What is record income? Income expenditure. Income and expenditure. Receipts in the form of fee collection, receipts in the Sorry for the inconvenience. There is a record of income and expenditure. Receipts in the form of fee collection, receipts in the form of donation, purchase or payment dues, and stock register. Tangible register and register of learning equipment, toys, stationery items, asset register, library, books, furniture, electricals, and this is the register. Serial number, name of the article, date of purchase, quantity of article, price, rate of the article, receipt bill number with date, from which firm, agency, article is purchased, authority ordered for purchase, article issued, signature of the receiver, signature of the in charge. All this should be maintained in the stock register and visitor record and visitors record. The visitors record could be serial number, name of the visitor, suggestions and compliments. What are the, if any visitor came to visit our center, then the name of the visitor and comments of that visitor and compliments of the visitor should be noted. And parent education program record. Topic related to early childhood development, activities, stimulation, planning for parent-teacher association. All these should be available in the parent education program record. And daily report, child behavior and issues related to child adjustment. And monthly record, day by day activity should be recorded in the monthly record. And record program plan. Requirement of daily schedule. What is the daily schedule? All the center must have schedule for each group of children posted for easy reference by parents and by caregivers. The written schedule must show blocks of time usually assigned to types of activity. What type of activity is going to present and play. That activity timing should be maintained. That activity schedule should be maintained in the record and include periods of time for both active play and quiet play or rest. Everything should be noted in the schedule. And blocks of time must be shown activities that are scheduled indoor and outdoor areas. What are the indoor activities are scheduled and the outdoor activities also should be maintained in the record book. The activities and allotted time reflected in the schedule must be developmentally appropriate for the children in care. When children 2 years old or elder are in daycare, the schedule must also reflect daily opportunities for both free choice and teacher-directed activities. The written schedule must include all the activities for the day from time the center opens until closes. Each and every activity should be noted with written. The schedule serves several purposes. That is, it shows what children actually experience each day. Should you know so, and establish a routine that helps children know what to expect on most days. For example, circle time, nap time, and follows lunch and different play times. It helps parents to know appropriate when the child will be involved in certain types of activities. In case they want to observe the program, join them for lunch, or avoid picking them during their favorite activities. A scheme of schedule helps caregivers Play a day of activities around blocks of time usually work for children in that group. There are times when you need to be flexible with written schedule to meet special needs of the day and meets the needs of the whole group and meet an individual needs. All this should have by the teacher. Teacher director activities are planned and started off by staff and children are invited to participate. For example, sitting up and guiding a art activity, reading to children during circle time, or teaching children a song, etc. The schedule should reflect opportunities indoor and outdoor for free choice and teacher director activities. A daily rest period must be provided for each child in child care. It is recommended that children be offered a minimum total of 1 hour of outdoor time throughout the day if weather conditions permit. And health report, growth monitoring immunization schedule. In the health reports, it should be maintained. The growth monitoring and immunization schedule. What is the immunization time? What is the month in? What is the immunization schedule will be given. Requirement for child's health assessment. Each child must have health assessment before being admitted or within 30 days following admissions to a child care center. The assessment must be completed and signed by one of the following: a licensed physician, the physician's authorized agent, a certified nurse practitioner, a public health nurse meeting, the department standard, or early periodic screening, diagnosis, and treatment program. Reviewing health assessment information carefully to see if there is health care information such as allergies, special diets, prior medical history, asthma, and any infections, etc., that you need to be aware of to be able to provide proper care. Until unless the caregiver aware of these things, it is difficult to handle a smooth and difficult to handle and smooth running of the center. Although not required, request of parents update the children health assessment information annually. After each annual well check visit to a physician or when a child medical condition changes, such as being diagnosed with an allergy, to ensure you have the most update health information on file. A sample child's medical report form. If a center chooses to develop its own health assessment form, it must be include every item of information found on the sample form. The top portion of the sample form should be completed by the child's parent or guardian. A healthcare professional should complete the bottom portion of the form. First, immunization record. This should be maintained by the parents. Each child must have an up-to-date record of immunization and file at the center within 30 days of enrollment. A current immunization record showing child's age appropriately immunized or not must remain a file for each child while in care. Child care operators must request a certificate of immunization for every child on the first day of attendance. If a certificate is not presented on the first day, the operator must notify the parent has 30 calendar days on the first day of attendance to obtain required immunization for the child. Child care operators must request parents to provide a copy of each child's immunization record whenever new immunizations are given. The caregivers must complete annual child care immunization record, and each center should receive the form with instructions in the mail each year. Emergency medical care information must be on file for each individual child. The emergency medical care information must be included in the following, that is, name of the parent, other persons to be contacted in case of emergency, address of the parent, other persons to be contacted in case of emergency, telephone number of the parent, and other person to be contacted in case of emergency. The responsible party choice of health care provider and preferred hospital and any chronic illness the individual child has, any medication taken for that illness. All this information should have a caregiver. It will help in the child's development and smooth running of the center without any hurdle, without any emergency. The emergency medical care information must be on file in the center on the child first day of attendance. Remember to update the information regularly, monthly or year, 3 months, every quarterly or yearly. Because every month or every the medication will be changed and immunization schedule will be done by the parents. And incident reports. An incident report must be completed each time child receives a medical treatment by a physician or physician assistant, the nurse practitioner, a dentist, community clinic, or local health department, or result of incidents occurring while the children is at the child care center. The incident report must include a minimum, that is child name, type of injury, piece of equipment involved, date time of incident, name of adults who are saw the incident, part of body injury, description of how and where incidents occurred, and where and what kind of treatment received. All this information should be kept in a record. Steps. What are steps to be taken to prevent reoccurrence? This must be signed by the person completely and by the parent and maintained in the child's file. A copy of the incident report must be mailed to the higher authorities within 7 calendar days after treatment. This requirement also applies when the parent takes the child to the doctor after the incident just to be evaluated. Next, permission to transport. Before children are transported, written permission from the parent must be obtained, which must include when and where the children is to be transported, expected time of departure and arrival, and the name of the transportation provider. Parents may give standing permission valid up to 12 months for routine transport of children and from the center. Permission to transport must be on file. A copy of the child emergency medical care information as well as emergency medical care authorization must be in the vehicle when the transporting children. This information is located on the child application form for the children care. A receipt of summary of the child care law. Operators of child care centers must provide a copy of the summary of the child care law to each child parent, guardian, and full-time custodian before the child is enrolled in the center. Each parent, guardian, or full-time custodian must sign a statement acknowledging that he or she received a copy of the summary before child's enrollment. The systematic maintenance of records and registers in a daycare center will enable the worker to be effective in planning stimulative programs and monitor the individual child's growth and development. Childcare programs must establish and implement the planned program of daily activities based on each child's individual development at each stage of early childhood. Childcare providers should be clear about the curriculum and the activities they plan to be implemented. Having a written description of the planned program of daily activities give some staff and patterns a common understanding. The written plan helps define the service and contribute to the relationship between the provider and parent. All records of any child center except financial records must be available for review of higher authorities or manual. A good record keeping system will help save your time. By keeping your records organized and located in one place, you will have an immediate access to emergency information for children and staff. In case of any emergency, in case of any emergency situation, center staff may need to grab the records, that is contact information, emergency contact person, emergency contact information, and emergency contact hospital, emergency contact doctor's name, all this available in the this records. All should be available in the records with daycare center. In the this health information and children attendance list, the staff applications of the children and staff to evacuate the center, it should be available easily, or it should be accessed everyone easily. It might be helpful to store this information